It's a tough truth to this pandemic that self-harm is on the rise in teens and young adults. And now there's an effort underway to understand how that impacts their peers. Here's Vanessa Mashanya.
Unprecedented times, grim milestones, phrases we've heard so much the last 2 years of our lives that they've lost their initial commanding impact. Their significance has now dulled away into background noise. For anyone who has struggled with mental health over this time, however, certain background noises have been amplifying. Intrusive thoughts and behaviors that may have been drowned out with pre-pandemic routines are now so loud that everything else in life, family, friends, career, school, has fallen out of view, making room only for the internal storm so many of us navigate in secret.
And it's challenging enough for an adult, but it's particularly heartbreaking for children and youth and for their families who are watching them suffering.
Kenneth Norton is the executive director of National Alliance on Mental Health New Hampshire. They've been watching how the pandemic has impacted the mental health of everyone, but especially young people. It's hard to get exact data points on just how the pandemic has impacted mental health, but what they have been keeping track of is emergency department boarding in the state. People who are experiencing a crisis and are a danger to themselves or others, yet, due to a lack of inpatient beds, stay in the ER. Since March 2020, those numbers have tripled, even quadrupled in some cases.
Figure is the most visible piece. What's not visible is the number of youth and families that are seeking outpatient treatment.
National numbers reflect this trend. ER visits for suicide attempts in girls rose more than 50% in 2021 compared to 2019. For boys, they rose 4%.
Still, suicide is the second leading cause of death for people aged 10 to 34. So clearly, we need to find some different approaches.
Dr. Kimberly Mitchell is a research associate professor at the University of New Hampshire. Her team just received a $3 million grant to conduct a massive study looking at youth bystanders, friends or family of youth who are at risk of dying by suicide, to see what is the best way people who love the person in crisis can help save their life.
One of our ultimate goals is to help inform prevention. So the more we can actually get in and help kids identify and help these, their friends, their family, people they're close to, the better.
The good news is that people are seeking help.
One positive in all of this, Kenneth says, is the fact that mental health is being discussed more than ever, and more avenues of help continue to open up, including a bipartisan bill that just passed the Senate that encourages states and schools to boost suicide prevention education.
If we can provide more mental health supports in schools, if we can change the culture of the school so that all students feel included and a part of that community and have that connectedness, that can really make a difference.
Helping to get a lifeline out to those stuck in their own storms, letting them know they don't have to sail them alone. I'm Vanessa Mashanya reporting.
The race continues next.